Hello, everyone. I'm Dr. Zeinab Hijazi, the Global Mental Health Technical Advisor at UNICEF based in New York. I'm pleased to be co-chairing with my dear colleague from WHO, Chiara, the second session focusing on child and youth mental health, part of the Mental Health for All webinar series brought to you by United for Global Mental Health, Lancet Psychiatry, Mental Health Innovation Network, MHPSS.net, and the Global Mental Health Action Network. Chiara, over to you for a quick introduction.
Thank you very much, Zeinab. Delighted to be here and contribute by helping moderate this very interesting conversation. I'm Chiara Servili, a technical officer working on child, adolescent, mental and brain health at the WHO Department of Mental Health and Substance Use in Geneva, Switzerland. Over to you, Zeinab.
Thanks, Chiara. And before we begin, just a reminder to everybody that this session is being recorded. We, of course, encourage you to tweet about the webinar throughout the session. Please use the hashtag MH4All when tweeting about this webinar. The length of the session, as a reminder, will be 45 minutes. Please do send any questions that you might have to webinars@unitedgmh.org or write them in the chat box. So let's get started. On April 6th, our session was focused on early intervention and prevention and the importance of caregiver mental health. Today, we will discuss youth mental health with a wonderful panel who I am pleased to introduce. First, we have Matt Hughsam with citiesRISE. Matt is the Learning Collaborative Manager at citiesRISE, whose mission is to transform youth mental health through local innovation, coalition building, and youth-led action. Matt's background is in leadership development and community organizing, and he is passionate about bringing grassroots and system work together. Welcome, Matt. Second, we have Yves Miel Zuniga. Yves is one of the co-founders of MentalHealthPH. He is a youth-led advocacy organization. MentalHealthPH is a youth-led advocacy organization that aims to protect, promote mental health in the Philippines through social media and digital technology. Yves is also a fellow at the Royal Society for Public Health in the UK, and was chosen by Facebook as one of the 77 global community leaders for its prestigious Community Accelerators program. Yves is currently the Senior Health Program Officer at the Philippines Department of Health, where he is co-leading on assessments on the COVID-19 vaccine. Third, we have Aviwe. Aviwe is the Program Policy and Advocacy Manager at Waves for Change. Aviwe is very embedded with the SURF sites, but also holds the new advocacy strategy and is supporting Waves for Change with making links with decision makers locally and internationally. She also leads a lot of the youth development work with the coaches and with youth development positions in the office. And finally, we have Joanna with UNICEF. Joanna is the technical focal point for adolescent health, mental health, and school health within the health section of UNICEF headquarters. As part of her role, she coordinates UNICEF's engagement on the joint WHO-UNICEF Helping Adolescents Thrive initiative. Without further ado, Chiara, over to you to kick us off.
Thanks, Zeinab, and a warm welcome for me also to the participants and to the panelists. I'd like to thank United for Global Mental Health for the opportunity to join and help moderate this important conversation on youth mental health today. We know that 1 in 7 adolescents have a mental disorders. During COVID-19 pandemic, the prevalence of emotional disorders and also risk behaviors have increased. We are yet to appreciate the full impact of the pandemic on developmental and well-being trajectories of young persons, but we all want to seize the opportunity of the increased international awareness on youth mental health to build back better and improve services and environments for children, adolescents, and families, and ultimately really impact their well-being and development trajectories. But what exactly do we want to see happen in countries? From WHO perspective, priorities include improving programming for adolescent mental health promotion and protection, with a focus on improved environments for adolescents and families. And when I say environments, here, we talk about schools, families, but also the digital spaces. Other priorities include reforming care services, improving quality of care for promotion, prevention, and care, throughout, with a developmental perspective and a continuum of care, again, for children, adolescents, and families. We focus on strengthening the workforce capacity, also specifically with a focus on improving access to scalable psychosocial interventions for adolescents through various platforms and across, different types of modalities to reach adolescents, including with online and remote type of strategies. But today, we have a very distinguished panel who is going to share their perspective and experience with supporting youth mental health. I look forward to hearing from them. And over to you, Zeinab, to introduce the first round of questions.
Thank you so much, Chiara. And maybe a quick reminder to the audience that last July, the Secretary General Guterres launched a policy paper on COVID-19 in an urban world. And the importance of such a paper was really founded by urban areas really proving to be the epicenter of the pandemic, where slums and informal settlements were and remain the most effective. Now, we all know the devastating direct and indirect impacts that COVID has had on the mental health and well-being of our children across settings. But I want to, with this and with the knowledge of this really important policy paper, my first question is to you, Matt. Can you tell us a little bit about why it is so important to address youth mental health in cities and urban areas specifically?
Definitely. Thanks, Zeinab. So first, speaking pragmatically, if we want to reach a large groups of young people, demographic trends suggest that 60% of all city dwellers will be under the age of 18 by 2030. And then, as you mentioned, the challenges that young people globally are facing, whether it's pandemics, mass migration, intense urbanization, global heating, these are all really intensified in cities. I'm speaking to you here from New York, and then I can also say that cities are also often hotspots for social movements. And so young people in cities face numerous challenges and then also several opportunities. So it's really important that we intervene for young people in cities. Beyond the need and the importance of serving young people in cities, cities have long demonstrated a willingness to pursue innovative policies and programs that can be then scaled more widely. In cities, we see that there are really high concentrations of system leaders and youth leaders and social entrepreneurs, and there's opportunities for really rapid and creative multidisciplinary collaboration that can really push the progress on how we support young people. And then finally, with citiesRISE, really core to our model is connecting cities to each other. So we currently work in Bogota, Chennai, Nairobi, Sacramento, and Seattle. So being able to support learning and collaboration across these really diverse spaces, across cultures, across geographies, results in stronger impacts for youth mental health across the cities that we work in.
Thank you so much, Matt. It's really wonderful to hear about the kind of multidisciplinary approach that you take and this, really nice cross-cultural knowledge exchange. And we'll be excited to hear more about that as we move forward in this session. Yves, I'd like to come to you now. And while, of course, not without its challenges, we've come to appreciate the importance of social media in engaging youth around their mental health and that of their communities. How does MentalHealthPH use social media to campaign for action on youth mental health?
Thanks, Zeinab. So as an advocate, we have a prime responsibility to make social media a safer spaces for everyone, especially the youth who are very vulnerable to different mental health conditions, especially with this kind of pandemic that we are in. Aside from that, mental health advocacy is very strategic to be used through social media since this channel is free, it can reach everyone. And in the case of Philippines, virtually 4 in 5 Filipino youth actually have access to social media, but not discounting the fact that there still are other youth out there who may not have access to these, but we have to start somewhere. And through this, we're able to champion for safer spaces. And not just that, we're also able to mobilize important causes such as the passage of the mental health law, which are predominantly led by passionate young leaders 3 years ago. And we're actually celebrating the 3rd anniversary of it come June. Aside from that, we're able to reach more networks without even getting there physically, especially with the limitations now. We've seen that The youth actually have created their own tribes for a sense of belongingness to cope up and in order to find ways how to actually manage their stress and anxieties because of what's happening right now. So we see how social media is important, but at the same time, it doesn't stop from there. We also have to approach it via a societal and systemic approach. So Mental Health PH right now actually forges a partnership with Twitter International as a member of the Trust and Safety Council to ensure that these spaces remain safe for everyone as much as possible. So alongside that, there are more upcoming. Maybe later I can discuss more.
Thank you so much, Yves. I mean, you've highlighted multiple points here, solidifying how essential it is to support young people to meaningfully participate, to voice their opinions, and lead global, national, and country-level mental health initiatives. I think it's always inspiring to hear how youth can be active rather than passive in policy work and ensuring access to mental health services. We'd definitely love to hear more about the mental health law and how it hopefully it will come to pass through the engagement of youth. I'd like to turn to Aviwe now. Aviwe, can you tell us about the work of Waves for Change and particularly the work you do to promote good mental health among young people?
Thank you so much for having me. Waves for Change is a mental health surf therapy program. It is an evidence-based mind and body therapy that's using surfing to provide children from overexposure communities where they're exposed to repeat trauma, as well as children that are differently abled in terms of coming to our program, where they're exposed to our surf therapy program and they receive the adequate tools to help them cope with stress and also make positive decisions, build positive relationships, as well as build healthy relationships in their communities and live a positive life. So that's basically what we do at Waves for Change.
Thanks so much, Aviwe. And I wonder if you can maybe speak to also, I mean, you mentioned the different types of struggles and also, you know, the therapy side of it. I wonder if you could also speak to youth mental health and requiring more of a pyramid of interventions through promotion for all youth, protection of at-risk groups, and then the management treatment piece that you already spoke to. Can you give us that comprehensive overview?
Yes, so our program is mostly focused on preventative mental health care. And so many of the children that are referred to our program are in volatile communities, communities where they're exposed to violence, high rates of gangsterism, a lot of poverty. And because they're exposed to this type of trauma on a repeated basis, we found that these children, by the time they reach the age of 14 years, they have a higher chance of having mental health illnesses. And so our program is more focused on the preventative measures. And that's why we start working with children at a very young age, at 9 years, to help them develop tools when they go back to their communities, but also when they are exposed to the same stresses, whether it's at school, whether it's at home, and that they'll actually make a different choice and in terms of how they would have responded to the stresses or to the trauma and actually develop positive mental health practices.
Thank you so much, Aviwe. Very, very well said. I mean, we talked on April 6th about how early intervention and acting early through prevention activities is really critical. And it's really important, I think, to also think about how adolescents and youth really is also an important second window of opportunity for prevention and for promotion. And I think with that, I think it's a really wonderful segue actually to Joanna. Joanna, what is UNICEF's approach to adolescent mental health, and how does it fit into the broader global mental health agenda?
Great. Thank you so much, Zeinab. You know, I think at the core of UNICEF's approach to adolescent mental health is that, you know, we put adolescents at the center, which sounds obvious enough, you know, but it means then a push for having increased availability of comparable data and information about the mental health outcomes and, you know, determinants for 10 to 14 and 15 to 19-year-olds, particularly in low and middle income countries, so that we know, what it is that we're working to address specifically, and also that we are able to measure changes that are going to happen, going forward, whether that be because of investments and policies and programmings that, everybody's talking about here, or whether certain, changes in the environment are happening that would be shifting something. So I think right now, the data we have is kind of representative of a small segment of the population, and for us to have population level data in these countries is important for us to build an adolescent centered response. I think it also means, as you've also mentioned, Zeinab, and others have mentioned, that we center the policies and programming around not only responding to the particular vulnerabilities that adolescents face, in early adolescence and late adolescence, but also that we're building on the particular strengths that they have in this particular phase of development. And luckily for us, as Yves has also mentioned, and Matt's also mentioned, that young people are increasingly vocal about what their needs and wants are when it comes to mental health, and they're increasingly open to working with us and conversing with us about the solutions. So I think that's very important. I think another core aspect of UNICEF's approach is that we respond multisectorally, and I think for UNICEF that's really meant embedding mental health across the goals, in the different sections across our organization, and also the accountabilities, whether that's in child protection or education or in health or in other aspects. That has been important for us to think through as well.
Thank you so much, Joanna. I really appreciate your articulation of a multisectoral approach that is really, really critical in order to meet the very often complex needs of children and youth, and also be able to ensure that we are looking at the different entry points to ensure access, especially to those who need it most, and especially to those youth who might be at risk and would otherwise fall through the cracks. So really engaging all sectors in a comprehensive approach to meeting the needs of mental health needs of youth is indeed very critical. Thank you so much for that, Joanna. Chiara, I'm handing over to you now for some thoughts and of course for some follow-up questions.
Thanks very much, Zeinab. I have one more question for each of the panelists, as we would like to hear more specifically about the different approaches and experiences, in terms of supporting mental health of adolescents. To begin with, I'd like to ask a follow-up questions to Matt. Can you tell us more about what has worked best to support youth mental health in cities, particularly? Over to you, Matt.
Thanks for that question, Chiara. I'll touch on 2 points, and the first really begins where Joanna and Zeinab ended, and what we also heard echoed from the other panelists of the need for real intergenerational partnership. At citiesRISE, our approach is to, in a city, activate diverse cohorts of youth leaders, support their leadership, and then connect them to the systems and the leaders or experts or researchers that don't traditionally work with them as respected partners. We do this through several ways that we've seen have been really powerful. One example is the Youth Challenge Award, so where citiesRISE provides direct seed funding and technical assistance to youth-led and youth-driven innovations. We've seen really amazing and innovative models, including ones that have responded and really pivoted during the pandemic, whether it's embedding mental health and healing into a hip-hop recording studio that's embedded in a service center for youth experiencing homelessness in Sacramento, or young people in communities using graffiti as a way to build awareness in communities in Bogota. And so we see these really amazing ideas that emerge when young people and others come together to collaborate. The second area where we've seen real progress is taking a systemic lens on young people's mental health and well-being. And I think Yves touched on this as well. So we really believe that in cities, young people don't just have individual level needs. The relationships that are around them, as well as the environments and systems that surround them, have really significant impacts on their mental health. And so just taking citiesRISE's work in schools as an example, a lot of schools' work globally is more focused on single interventions that have a very specific focus, whether it's building mental health literacy or social emotional learning or building coping skills. What we found really works for young people and works for schools is taking more of a whole school approach, where we don't just provide those crucial things to young people, but we also engage their peers, their teachers, their parents, the school administrators, to all collaborate together to create a whole school environment that's mental health friendly for young people. And so in cities, we found that this more systemic lens and systemic approach to supporting young people is really, really important.
Thank you very much, Matt. Indeed, very interesting to hear about your experiences and your lessons learned in terms of youth-driven innovation models and also the systemic approaches to improving environments for adolescents. My next question is for Yves. We have heard about the important achievements of passionate young leaders. As we know that the Philippines has elections in 2022, what do you want the political parties to promise they will do to improve youth mental health? And also, can you tell us more about your upcoming work and any projects that will be launching soon? Over to you, Yves.
Thank you, Chiara. So in the Philippines, actually, the youth comprise 30 to 40% of the voters' population. So it tells a lot, but beyond numbers, it's all about the youth taking part in nation building, because a good future also means a good mental health for everyone. So we've seen, like, for example, an organization conducted a survey among 50,000 youth members. And majority of them are actually telling that good governance is something that's very needed right now. The pandemic has actually exposed how fragile our health system can be and the importance of strategic and human leaders who actually listen, not just to the cries of the members of the nation, but more so important, putting youth mental health at the front and center of pandemic response. So I think this one is a good eye-opener for everyone, how we can actually put in radical changes in mental health landscape of any country with the power of one vote. So right now, MentalHealthPH is also taking a proactive stance on voter education, how youth vote is important, how youth is important in nation building, in catalyzing changes in the mental health landscape that we are in. And aside from that, some partnerships that are ongoing are actually focused more on the long-term benefits for the youth. So let's say, for example, partnership with tech companies in coming up with an app for youth mental health, because we know for a fact that it is a basic need, and getting help should be as easy as ordering a pizza over a food app. So things like those actually have positive changes if done right and if partnered with the right stakeholders on board. So aside from that, Mental Health PH, aside from other members of a mega network, actually formed a coalition in order to create, hopefully in the soonest time, to create a mental health agenda for different political leaders, so that whoever comes in seat come 2022 will always ensure that youth mental health is prioritized.
Thank you. Would you like to add anything about your upcoming work or any projects?
Sure. Actually, it might be too early to say, but we've partnered with some social media organizations to come up with a mental health chatbot, because we've observed that we're receiving a lot of inquiries, a lot of cry for help in our different channels. So one way to actually help them is to bridge them to the professional help that we need. So aside from that, we also ask people through crowdsourcing and even hired professionals to validate information, because what you know can actually save lives. And with the right information, we can bridge youth to the right people that they need at any time, at any rate.
Thank you very much, Yves, for this update on projects and also, for your, important reflections about the the priority, that in terms of having good governance, leadership, and partnerships in place, really, to have youth mental health at the center of health for adolescents, and also, specifically in terms of it being at the forefront of COVID response. I'd like to pose a question to Aviwe. You have conducted research on heart rate variability to see how your SURF therapy can help young people affected by chronic adversity or trauma. Can you tell us more about this study and its findings? Over to you, Aviwe, for sharing your research findings and any implications for us.
Thanks, Chiara. So when we started doing the HRV study, it was because we had been doing self-report study with our participants from the beginning in terms of our organization, and we found that some of the data may be skewed and not necessarily accurate because a lot of the time the children would report what they would think sometimes we want to hear, and it wasn't necessarily accurate to measure what actually is happening, not only in the physical or the external of the participants, but in terms of how is the program impacting how they think, and also their heart rate when they're exposed to stress. Do they shut down? Do they have a fight or flight response, or do they actually have a relaxation response? So oh, sorry, I just saw something on the chat. It's not for me. So some things that were very important for us in terms of what were indicators in terms of the HRV study was that HRV could help us to tell in terms the capacity to self-regulate in terms of our participants, whether our participants were able to adapt to changing social and environmental demands, whether our participants could I'd have self-awareness, sustained attention, social interaction, and then also coping styles. And this is something very important because of the nature of the communities in which our participants come from. And it was important for us to get this data to see what actually is the outcome of when they go through the 12-month program with Ways for Change. And what we learned from the HRV study is that our program has a positive effect on the minds of the participants over an 8-week period. And we also decided that this doesn't mean that we should stop exposing the participants after 8 weeks to our program, but that the more they have exposure to the program, the better they are at self-regulation, at building positive relationships, at coping when they're exposed to stress. And then also that it helped our participants. We found that HRV is helping us be able to say that our program is important in finding for mental health and prevention programs in how toxic stress actually impacts the brain structure of our participants. And also that through neuroplasticity, the brain can itself recognize new neural connections, and that over time, these neural pathways can actually improve, whereas for children where they had been exposed to toxic stress, this had a direct impact on how their brain developed over time, and that the longer they stay in our program, their brains were able through neuroplasticity to actually be able to form positive neural pathways that actually help them in their decision making and their responding to stress. That we found also that the longer the participants are in our program, they're more open to learning and retaining information. And that also over time, our participants are able to relax in times of stress. They have relaxation responses. Children that shut down when they're exposed to high levels of stress or trauma, that there is a form of response, that there's increased activation in their brain. And then in terms of a fight or flight response, that they're able to actually calm themselves down and think before responding. So these were some of the findings that we got from our heart rate variability study. I also just want to say that we worked with the University of New School in New York for the study. And we measure the study at baseline, so when we begin our program in February, and then we have mid-year as well as end of the year test, just to measure what the progression was in terms of how our participants are responding to stress the longer that they're in the program.
Thank you very much, Aviwe, for this very interesting illustration of the results of the program, from the perspective of the impacts on brain health and development in children and adolescents. Very interesting indeed. Thanks. It is with pleasure that I invite Joanna Lai, one of our colleagues from UNICEF, to talk about the WHO Helping Adolescents Thrive initiative. I would like to hear from you, Joanna. How do you hope that this initiative, this Helping Adolescents Thrive initiative, will be used to progress youth mental health and catalyze action? Over to you, Joanna, to illustrate, the perspective of WHO and UNICEF on this joint program.
And I apologize. There's New York City. There's construction right outside, and it's so loud. But I hope you guys can hear me okay. I think that, the Helping Adolescents Thrive package is something that, UNICEF and WHO and also partners and collaborators have been working on. And really, one of the key parts of the package is first the WHO guidelines on recommendations for what kinds of psychosocial intervention should be provided for adolescents for promoting mental health, preventing mental disorders, risky behaviors, and self-harm. And I think these recommendations are specifically for 10 to 19-year-olds across the board, but there are also recommendations for specific at-risk groups. And these guidelines, are significant because I think it gives us a common agenda for action, moving forward in terms of adolescent prevention and promotion. And the hope really for this Helping Adolescents Thrive package is that these recommendations don't just stay recommendations, but that they get translated into solutions that are replicable and scalable. And for that, we have actually a HAT toolkit that's going to be released on May 18th, so just about a month from now. The toolkit really does outline strategies, activities, and also examples for what kinds of intervention and programming could look like in terms of prevention and promotion for 10 to 19-year-olds. And there are also several HAT tools that we're developing in close collaboration with country implementers and young people. For example, a comic series on social emotional skills building and learning for 10 to 14-year-olds and a teacher guide that comes with it. And that will be released, the first part, also on May 18th. And again, our hope with these, making these implementation tools and materials openly available and accessible and easy to adapt across different country contexts, is that it would be more feasible to mainstream delivery of prevention and promotion across different sectors and also different delivery platforms. If it's like with Yves through social media, or if it's with Aviwe through surfing, through citiesRISE in urban centers, that there are still some common elements and components that we know are evidence-driven, but we can adapt for use different across different contexts. And I think the success of HAT will really, in the next phase, rely on collaboration with different, a range of different partners, including all of you here, to make sure that it reaches young people more broadly.
Thank you very much, Joanna. And from WHO side, we would be, also very happy to keep collaborating, on this with UNICEF and all other partners and collaborators on the ground. I would like now to invite Zeinab to help facilitate questions from the audience.
Thank you so much, Chiara, and thank you to all the speakers for their really thoughtful contributions. We do have a few minutes for some questions. I see 2 questions from the audience that I'd like to put forth to our speakers. The first question is for Cities for Met from citiesRISE, and the question is: do you also support youth with autism, and if so, how? So I suppose this speaks to more of the kind of the continuum through on which you work at citiesRISE, and whether or not you're also targeting specific groups in your programs.
Got it. Thanks, Zeinab, for passing on that question. So citiesRISE doesn't right now focus explicitly on clinical services for young people with autism. Our work largely falls more on the promotion prevention side. However, one aspect of the work that we do, whether it's in schools or colleges or community settings, is for young people who need it, connecting to care. So we are really lucky in all the cities that we work in to collaborate with local mental health professionals, psychiatrist associations, and so on, to both figure out how can we make care more youth-friendly and bring it closer to communities.
Thank you so much, Matt. That's very clear, and it's interesting because I think across the different responses, we've heard really great examples around youth programming across that prevention, promotion, care continuum. So it's really important to kind of establish how great it is that we are working indeed collectively across that continuum. And we've also really touched on youth engagement across that continuum, linked to advocacy, policy, and programming, which brings us to this second question from our audience as well. And I feel like it could be just, it could be answered by perhaps maybe Aviwe and Joanna. And the question is, what would be the key lessons that can be modeled in Africa to advance youth mental health? And perhaps maybe Aviwe, if you could take the first stab at that, would be great.
Thanks, Zeinab. So I love this question because I think it's something that's very close to my heart and something that we are really pushing for as Waves for Change. One of the key things that I believe we need to help advance mental health in Africa is the literacy gap. In most local African languages, there is no word for mental health, mental illness, depression, anxiety. And so one of the things that we're really working towards as Waves for Change is how can we translate our existing mental health tools, but also create a community in South Africa and on the continent that says we want to actually make mental health tools and mental health the discussion around mental health something accessible, so creating literacy, because I think most young people in Africa are not necessarily first language English speakers. So is a key important point. And then the second one for me, I believe, is influencing policymakers and decision makers so that we can actually close the treatment gaps and prioritizing mental health at a governmental level, at a health services sector, at a community level, and bridging the divide that exists between these 3 layers of society, and saying that if we can actually build collaboration and how can at a government level have policy that prioritizes mental health across the different African countries, but also saying to the health services sector that you cannot tackle mental health on your own, that grassroots community organizations are much needed. And then at a community level, be able to empower young people to speak about mental health, to destigmatize mental health, and actually touch on these important topics at a community level and educating one another. So those are the 3 points that I believe are really important in terms of advancing mental health in Africa.
Thank you so much.
Sorry, that is this. I'm very sorry about it. I hope it's okay. You can still hear me.
Yes, no, please go ahead, Joanna. Yeah.
No, I was just going to say that, I think Aviwe, perfectly articulated, what's so important about programming for, Africa and other regions as well. And I think just to add upon that, I think some lessons learned or some things that we've seen might be important is making sure that the home and the school is a safer place for children and young people. And so that really might mean working with parents more, supporting caregivers, also teachers and educators who can help in terms of building and reinforcing these mental health literacy and skills, but also creating that support that young people would need.
Thanks so much, Joanna. And I don't want to move on before I give the floor also briefly to Yves, because you spoke a lot about this really wonderful intervention model, and also spoke to some important youth engagement and really kind of policy level work that is being led by youth within the Philippines. So I wonder if perhaps you can speak to that as well, and how it can be used as a model for other countries in Africa, but perhaps in others as well. But over to you if you have any quick thoughts on that.
Thanks, Zeinab. So we in Mental Health PH, we firmly believe that mental health is a fundamental human right, especially for the youth. So we are always governed by what we call the 3S framework in looking at different issues and even solutions. So the first S is the self. It's more on putting up awareness on mental health, building up mental health education, and improving well-being. Second is on the society. It's fighting stigma, and we keep the conversations going, especially in the online sphere, so that we're able to normalize, the stigma attached to mental health until it's no longer there, and also to zero in on the suicide cases among the youth. And finally, at the systems level, we wanted to make everyone realize that mental health isn't just the problem of the health sector. It should be everyone's business. Public housing is mental health, stable job is mental health, a safe home and the school is also good mental health. So there are different factors interplaying together in order to contribute together towards a better youth mental health. So that's our model, which is the 3S framework.
I love that. Thank you so much, Yves. And also, I mean, I totally agree. Mental health is and should be everyone's business. And indeed, we see mental health as an accelerator for all of the sustainable development goals. So I think it's certainly a language that we all should uptake with you. So thank you for that. Moving on, we're coming near to the end of the session. I definitely want to thank all of you for your insightful discussions. We don't have any more time for questions, but please do, feel free to continue the conversation, and we'll have some more information about that later. But before we end, I want to hand over to the panelists one more time and invite you to share a tweet-length answer to the following question. And the question is, what is the most urgent priority for supporting young people's mental health? Let's start with Matt, then Yves, Aviwe, and then Joanna.
Thanks, Zeinab. So for us, the most important priority is to partner with young people to integrate mental health in the spaces where they already are. So there's schools, colleges, communities, informal settlements, and not just transferring clinical care to those settings, but embracing holistic approaches that leverage young people's inner strengths and delivered through ways that resonate with young people. So things like arts, things like peer support, things that they've expressed will work.
Thank you, Matt. Yves.
For me, it's good governance, and good governance translates to good investments in mental health, and good investments give you better health outcomes.
Beautiful. Thank you, Yves. Aviwe?
Make mental health more inclusive, prioritize the different sectors of society, and collaboration is the future of mental health.
Absolutely. Thank you, Aviwe. Joanna?
I think building on what everybody already said, something is that we have more structured spaces for young people to connect and talk and be listened to. They shouldn't feel afraid to ask for help, and they shouldn't feel like they have to hide whatever it is that they're feeling.
Beautifully said. Thank you so much, Joanna. And thank you all. And over to Chiara to help us close the session.
Thank you very much, Zeinab. I also like to thank all the panelists for the contribution. providing their perspective, their different perspective and the different experiences and work, but all contributing to the common goal of prioritizing youth mental health and improving outcomes for adolescents and their carers. I'd like also to thank United for Global Mental Health for providing the platform for this interesting dialogue. Let's continue the conversation. Let's keep this conversation alive on social media now, and also, by joining, the next opportunities, for provided by, the upcoming webinars. The next webinar on this series it will be on Tuesday, 4th of May, and it will focus on mental health financing. Also, I would like to let you know that next Tuesday, April 27th, there will be a virtual launch of a new philanthropy and mental health research paper that United for Global Mental Health have worked on. You can find more information about this on the United for Global Mental Health social media and sign up there, or email webinars@unitedgmh.org. Again, thank you very much, and let's continue the conversation on social media now.
Everyone.